Good morning. My name is Ansel Trichard, and today I will be going through the protocols and scanning techniques of the carotid ultrasound examination. After this, you'll be going to the lab for your pracs. The learning objective of this carotid ultrasound study is to look through the anatomy of the cerebrovascular circulation, the indications for a carotid ultrasound, the aim of this lecture, the patient preparation, the ultrasound scanning technique using B mode, color flow, and pulse wave Doppler modes, the sonographic appearances of the vessels, and the worksheet and grading charts. The aim of this carotid study lecture is to describe the scanning procedure and protocols of the normal carotid and vertebral arteries. I will describe the normal appearances of these vessels in B mode, color flow, pulse wave Doppler. I will provide examples and images of normal vessels in these modes and how to achieve this with proper scanning techniques. I will provide examples of the normal waveform in the common carotid artery, internal carotid, and the external carotid, as well as the vertebral arteries. I will also illustrate how the worksheet and charts support your diagnosis. The indications for a carotid study is to detect atherosclerotic plaque and evaluate its morphology, to detect hemodynamically significant velocities, to exclude carotid pathology in the presence of symptoms of neurological deficits, to quantify the severity of the disease, the severity of occlusion or increased velocities, to detect other carotid pathology such as dissection and carotid body tumors. Let's look at the carotid anatomy. The right common carotid artery arises from the brachiocephalic and subclavian artery. The left common carotid arises from the aortic arch. We can see that in our diagram. The common carotid bifurcates into the ICA and the ECA. The internal carotid feeds blood into the brain via the circle of Willis, and the vertebral arteries feed blood into the brain via the basilar artery. The patient position. The patient is laying supine on the table with a small pillow or towel placed under the shoulder to extend the neck. The neck is exposed down to the clavicle. The chin is lifted and the neck turned away from the area being examined. The equipment we need for this procedure is a linear transducer with a frequency range of 5 to 12 megahertz, the preset, which is the carotid artery, and an ultrasound machine with B mode, color, and pulse wave Doppler modes. We will start the scanning technique in the transverse position, where we place the probe in the transverse position at the cricoid cartilage and move laterally to visualize the carotid artery in transverse in the center of the screen, as we can see in that image at the top. We sweep the probe proximally from the level of the clavicle and towards the head, towards the cranium, and assess the common carotid artery for intimal thickening and atheromatous plaque. At the distal part of the common carotid artery, the artery widens, and we call this the bulb, before it bifurcates into the ECA and ICA. The color flow Doppler is selected, and a straight box is placed over the arteries to look for any defect. This is a small video just to quickly show you how we will do that. So in a transverse position, we will then sweep the probe up and we will see the bifurcation. Common carotid, and there's the bulb and the bifurcation. So we will continue then to the longitudinal scanning technique. We turn the transducer through 90 degrees into a longitudinal position, and in B mode we slide the probe from proximal to distal common carotid and observe the bifurcation of the ICA and ECA. The longitudinal plane can be scanned from an anterior, a posterior, or a lateral approach. We repeat this in color flow and assess the color in the lumen for color defects and aliasing by placing the color box parallel to the vessels. At the bulb, before the bifurcation, a normal area of reverse flow is noted, and this is known as the boundary layer separation zone. You would have learned about this in your physics lecture. At the bifurcation in the ICA, it usually runs more posterior and is wider in diameter. The ECA is usually found more anteriorly and has extracranial branches. This is a short video in a longitudinal plane with color to show you the uniformity of the color in the common carotid artery up to the bulb. And here we have steered the box parallel. And at the very end, we then steer the box in the opposite direction as seen in the next video. And we can also then see the bulb and that reverse flow in that separation zone. The internal and then the external artery there in color. We will now place the pulse wave Doppler in the vessel to measure the peak systolic velocity in the subclavian artery and continue to do the pulse wave Doppler traces in the proximal, mid and distal common carotid artery in the longitudinal plane. The common carotid shows moderate resistance, and in the next slide I will show you the difference between the CCA, ICA and ECA waveforms. The sample volume should be placed in the center of the vessel. The peak systolic velocity and end diastolic velocity is measured in one of the cycles. The Doppler angle should be set at 60 degrees. We repeat this for the ICA and the ECA. The ICA has a low resistance waveform and the ECA a high resistance waveform. We can do a temporal tap to perform. We can perform a temporal tap at the external ear to confirm the ECA. The head is turned straight and the probe is placed anteriorly, and the vertebral artery is then assessed for antegrade flow. We can also then do the peak systolic and end diastolic velocity. Here we see the different resistance pattern in the common, the ICA and the ECA. So ICA has a low resistance and the ECA a high resistance flow pattern. This is an example of a worksheet where the columns give you the indication of where to place your peak and end diastolic velocities. And then we will also give the ratio of the ICA over the CCA and then discuss the plaque features that you see on the carotid. ASM has given us a grading chart, and this is what we use in Australia to depict the diameter reduction and increased velocity that will give us the percentage of reduction. In summary, we have discussed the anatomy of the circulation, the indications and aims of a carotid ultrasound. We have gone through patient preparation and the scanning techniques, as well as the different modes and the sonographic appearances of these modes, and the discussion of the worksheet and the grading chart. Please find the reference for your perusal, and we will now go to the lab to do the pracs. Thank you very much for your time.